Unfold in real time. Many are also still very much concerned coping with the effects of the pandemic. With all of that in mind, want to get some insight on how you can get through it. To help us out with that, we're joined by Dr. Andre Newfield, Chair of Psychiatry at Hartford Healthcare, St. Vincent's Medical Center. Doctor, thank you so much for being with us this morning. And I've got to start right here. So many people are anxious, distressed, depressed about what's going on. What are you hearing from your patients these days?
Well, everybody's emotional reserves are depleted after coming out of the pandemic. As we're returning to normalcy, everybody's a little bit more on edge. And so we're finding that, anything is going to maybe set them off a little bit more, particularly a crisis like the one in Ukraine.
Are you telling people, advising people to kind of stay away from checking out the news, what's going on social media, all the time during the day? Is that a good way to kind of de-stress from all of this?
Well, I think that, setting some boundaries is going to be helpful. You probably don't want to start your day with tough news. And so we're all connected nowadays with our phones, and we tend to wake up in the morning and check our feeds and what's going on. Mm-hmm. We might want to take a little bit of space from any crises that might set a tone for the day. And also, as we go into restfulness and sleep at night, we probably want to put the phone down and avoid, our minds spinning out of control when we're trying to get into a restful state as well.
What are some good tips on how to kind of get away from it all for a second? I know some people who like to watch old comedy shows from the 60s to kind of get totally away from it. What are some of the things you advise for people to try to move forward?
Well, I have my rule of 3 I's. You want to exercise, you want to eat wise, and you want to socialize.
I like it.
I think beyond those generalities, there are things that we can do like yoga or, certainly getting lost in a binge-worthy show or having a glass of wine. But the things that are more isolative, that don't necessarily address your true feelings or issues, have a tendency to sometimes be habitualized and could be a little bit of a black hole that sucks you in. So you might want to avoid some of those things. And, certainly if you're finding that finding those things on your own that are relieving you are difficult, you might want to seek some help with a therapist or even a psychiatrist that might help with medication.
All right, Dr. Newfield, we appreciate it. Thank you for the insight, and we look forward to chatting with you again real soon.
Thanks so much, Keith.